Welcome everybody, Nursing Institute, Mission Hospital, Rajshahi. I am Mohammad Jamaluddin, guest teacher, Basic Science, Christian Mission Hospital, Rajshahi. Yesterday we discussed about minerals. Now we discuss iron, the another minerals, important minerals in our body, which is very essential to keep our healthy and fresh mind. So, what is iron? Iron, like 20 minerals, iron is one of them, and it is a very important element for our body. It is found in every human cell, essential for growth, development, and normal cellular functioning. Iron is naturally present in many foods. Here, some foods shows it is enriched in irons. The source of iron. Normally, it is found in various natural foods. This is uh, uh, iron in food exists as two types normally, a hemo and non-hemo. Animal foods such as meat, seafood, and poultry provide both types and are better absorbed by the body. A non-hemo iron is found in plant foods such as spinach and beans. Grains that are enriched like rice and bread and some fortified breakfast cereals. The picture shows the rich food in iron. The beef spleen, pork liver, clams, potatoes, beans, lentils, spinach, fortified cereals. So we should take this food regular and a certain amount. Without this, we become very difficult. The function of iron, we know hemoglobin is important in composition of blood, and this hemoglobin is formed by iron or heme. Heme means iron. So in the bloodstream, iron act as a subtle picking up of oxygen inhaled into lungs, binding it during its transport in red blood cells, and then dropping it off again in the body tissues. Another reason is iron is necessary for enzymes involved in DNA synthesis and plays an important role in cognitive development and immune health. আমাদের মনে রাখা উচিত আমরা যে কার্বোহাইড্রেট খাবারগুলো খাই এটি আসলে ব্লাড এটি আসলে ডাইজেস্টের পর গ্লুকোজে ফর্ম করে। এই গ্লুকোজগুলো ব্লাড স্ট্রিমের মাধ্যমে আসলে কোষে পৌঁছে যায়। আবার রক্তের মধ্যে যে হিমোগ্লোবিন থাকে বা লোহিত কণিকা থাকে বা আরবিসি থাকে, সেই আরবিসি অক্সিজেনকে বাইন্ড করে টিস্যু বা কোষের মাইটোকন্ড্রিয়াতে নিয়ে যায়। সেখানে গ্লুকোজ এবং অক্সিজেন বিক্রিয়া করে সে শক্তি তৈরি হয়, যা আমাদের শরীরের চলার জন্য অত্যাবশ্যক। এই বিক্রিয়াটি আসলে যদি না ঘটতো তাহলে আমাদের পর্যাপ্ত শক্তি আসতো না, ফলে আমরা আস্তে ইনঅ্যাক্টিভ এবং দুর্বল হয়ে যেতাম। আর এই কাজটি, এই অক্সিজেন পরিবহনের কাজটি আসলে করে থাকে আয়রন। So iron is very important for our body. Another function is, this is RBC, the formation of hemoglobin, binding oxygen to RBC and transport. Formation of cytochrome myoglobin, regulation of body temperature, muscle activity, cholamine metabolism. It is another factor is immune system, brain development and function, and thyroid function. So you know what's important function role play. So what happen when you are low on iron? Iron deficiency occurs when the body does not have enough of the mineral iron. This leads to abnormally low levels of red blood cells. If your body does not have enough hemoglobin, your tissue and muscle would not get enough oxygen and be able to work effectively. effectively. This lead to a condition called anemia. The picture shows the fresh or normal uh, RBC and the anemia, the sort of anemia. If we suffer iron deficiency, these are fatigue. When you don't have enough healthy blood cell, you start to feel difficulty focusing, crazy sore muscle. Not having enough iron deprives your muscle their ability to recover properly, leading to the apathy from your friends, family, work. Brittle nails, it is like stones or cracking or craving. Unusually pale skin, normally অনেক সময় আমাদের ত্বক ফ্যাকাশে হয়ে যায়. This is the unusually pale skin. Pink or red urine, আমরা অনেক সময় আমাদের প্রস্রাব হলুদ হয়ে যেতে পারে. Shortness of breath, depression, hair loss, increased sensitivity to cold, restless leg syndromes, etc., etc. Anemia. What is anemia and how we know the anemia? So the symptom of anemia is extreme fatigue, weakness, pale skin, chest pain, fast heartbeat, or shortness of breath, cold hands and feet, inflammation or soreness of tongue, brittle, brittle nails, unusual craving for a non-nutritive substance such as ice, dirt, and stars. Here shows lots of symptom of anemia. That's mean eye yolking, skin, paleness, coldness, urine, respiratory, shortness of breath, muscular weakness, intestinal changed, stool color, central fatigue, dizziness, fainting, blood vessel, low blood pressure, heart palpitations, rapid heart rate, chest pain, angina, heart attack, spleen enlargement. This is causes or happened for lack of iron. So iron is very important for us. The causes of iron deficiency of anemia. It may be inadequate iron intake. Eating too little iron over an extended amount of time can cause a shortness in our body. Pregnancy or blood loss due to menstruations, heavy menstrual bleeding and blood loss during childbirth are the most common cause of iron deficiency anemia in women of childbearing age. Another reason is internal bleeding. A certain medical condition can cause internal bleeding, which can lead to iron deficiency anemia. Examples include an ulcer in your stomach, polyps in the colon or intestine, or colon cancer. The another cause is inability to absorb iron. We eat iron-rich food, but our cell cannot absorb iron. So uh, the anemia become happened. So certain disorders or surgeries that affect the intestines can also interfere with how body absorb iron. Endometriosis. If a woman has endometriosis, she may have a heavy blood loss that she cannot see because it is hidden in the abdominal or pelvic area. So what should we do if our body attack or lack of iron or lost iron or anemia become? So we should breastfeeding and appropriate weaning, dietary modification, Deworming, control of infection, supplementation, iron fortification, nutrition education, home gardening, care of pregnant and lactating women. So this is the iron deficiency and syndrome causes recovery EPC. So thank you very much everybody. See you later. Bye bye.